18 million a year, 50,000 a day, 35 a minute. Any idea what these numbers are? Could be a breath, could be the number of times you blinked your eyes at me, could be the number of times you checked your notifications on your iPhone, or a heartbeat, although I hope it's higher than 35 a minute. Well, I'm sad. I'm sad to tell you the truth, because the numbers I just shared with you are the numbers of deaths. Deaths caused by cardiovascular diseases. Every year, every day, every minute. That means that by the time I'm done finishing this sentence, roughly 5 people have lost their lives due to cardiovascular diseases, mostly heart attacks. According to the World Health Organization, 33% of all global deaths are caused by cardiovascular diseases. And due to the majority of CVDs and other diseases, there's a huge pressure on the healthcare industry to save human lives. But with the proper integration of technology, this pressure can be greatly reduced. But I have good news for you, because you're sitting here alive and kicking, and I'm standing here with a big smile on my face, because we're not in a hospital. We're at the conference in the country of the best beer and chocolate. My name is Rachel Smets, and I'm the PR executive of Divine WebTech. And today I'll be sharing about the collaboration between Vascular Wellness and Divine WebTech with the proper integration of Odoo as an ERP platform. Today, I will share about the integration of human and tech, of healthcare and tech, to save millions of lives. But it will also help you get ideas of how you can help your clients digitally transform their businesses. Since the beginning of life, we humans have rewritten the golden pages of history, from the discovery of fire to the Industrial Revolution of the modern era. Let me give you an example. Are you carrying your smartphone with you right now? You probably do. And if you don't, maybe you lost it or you forgot it. But that's a simple example of how you, and me included, are experiencing the Industrial Revolution on a daily basis. Other examples include artificial intelligence, cloud computing, data automation. And people are saying that AI is going to replace humans and take away all our jobs. But luckily, experts contradict this, because AI is all about empowering people, not the rise of machines. We've learned from the past as well that if companies and industries are not jumping on the bandwagon of technology, they will vanish. Any fans of Kodak or BlackBerry in the room? They will know what I mean. It's crucial these days that companies and industries take the route of digitization. And that is exactly where our brand, Divine WebTech, comes into play. Je sais pas si...
Predominantly across Asia Pacific, Europe and the Americas, covering more than 25 countries so far. We are official certified Odoo partner, registered in the US. We provide wide range of Odoo services including Odoo implementation, Odoo migration, Odoo consultation, Odoo integration, Odoo customization, Odoo support.
Back?
Divine WebTech is a comprehensive global information technology company that has been successfully empowering digital business transformation since 2009. With our expertise in ERP, e-commerce and AI, we develop solutions that make our customers stand apart from the market. Our passion is to provide cloud-based software solutions with a wide range of IT services around the world. We have implemented ERP software for businesses, ranging from startup to large enterprises. Having branches in India, Singapore and US, we have been providing our services predominantly across Asia Pacific, Europe and the Americas, covering more than 25 countries so far. We are official certified Odoo partner, registered in the US. We provide wide range of Odoo services including Odoo implementation, Odoo migration, Odoo consultation, Odoo integration, Odoo customization, Odoo support, Odoo hosting and customized Odoo apps development for your custom business needs. We are specialized in Odoo development for any business need, including manufacturing, sales, purchase, CRM, accounting, inventory, marketing automation, website, e-commerce and more. Our experienced and dedicated team of 40+ developers, working across different time zones, can bring your ideas and thoughts into reality. We are dedicated to build the best and the most cost-effective ERPs for any industry, and we have successfully completed more than 400 projects including healthcare, education, real estate, manufacturing, retailing, telecom, e-commerce and many more. We are committed to increase efficiency of system, products and services of your business. If you are looking for innovative, result-driven, friendly software developing team, then look no further. Reach out to us today. Browse through www.divinewebtech.com or drop us an email, support@divinewebtech.com. Innovate your business with us. Divine Web Tech. Truly innovative.
And now it's time to show vascular wellness in action. Divine Web Tech in action through Vascular Wellness, who has greatly benefited from Odoo's implementation on a day-to-day basis. This is Jennifer Atkin, CEO of Vascular Wellness, and she's sharing her company's goals, missions, and goals.
Hi, I'm Jennifer Etkin, owner and CEO of Vascular Wellness. Our mission and the core of who we are is improving the quality and safety in healthcare, and how we do that is by improving access to healthcare. Vascular Wellness provides comprehensive, quality, timely, and innovative mobile vascular access nursing services at the patient's bedside, and we do this for patients of all ages, from pediatrics to adults. Because of our extensive geographic coverage, we're able to come to the patient's bedside no matter where that is. It could be in tertiary or community hospitals, long-term acute care hospitals, or hospital at the home programs, also skilled nursing facilities, continuing care retirement communities, surgical and outpatient centers, hospice, as well as a patient's own home through an at-home care program. We place standard lines such as PIVs, PICCs, and midlines, and advanced central lines such as internal jugulars, mid-thigh femorals, tunneled central lines, and even dialysis catheters. We also provide program management, education, training, and infection control and prevention services. We're proud to support a greater than 98% success rate with a 0% insertion-related infection rate across all lines, with an average response time of 3 hours. This means we're able to enable therapy to begin quickly and improve patient outcomes. And it also means reduced costs, infections, readmissions, decreased hospital length of stay, and reduced transportation expenses for our clients. Nearly every one of us has had some sort of vascular access procedure, whether it's a blood draw or donation or a surgery. And most of us have had what we call a bad stick, and that's when multiple attempts have to be made. This often results in a number of issues, including bruises, painful sites, delays in the start of treatment that can negatively impact your patient outcomes, not to mention extra costs in time and supplies on the provider side. But at Vascular Wellness, we devote 100% of our time, effort, and resources to vascular access, and our nurse clinicians truly are vascular access experts. They're required to complete didactic, simulation, and extensive hands-on training prior to solo deployment, and they're also required to achieve and maintain vascular access board certification. And they're skill verified semi-annually. Because of this, and our expertise from placing thousands, hundreds and thousands of lines actually, we're often called in to achieve vascular access after previous attempts were unsuccessful. The most common response we hear from patients after a procedure is, "That was a piece of cake. I didn't even know you were done." And that is the best thing that we can hear from patients. Another point that makes us unique is that we employ a director of research and development to ensure innovation and best practice compliance. This innovation means we place advanced central lines, including small bore internal jugular, mid-thigh femoral and axillary lines, and large bore lines, tunneled central lines as well. And we also place VasCath and PermCath dialysis catheters at the bedside.
Wow. She said the patients are saying that that was a piece of cake. I mean, what a great compliment from patients. However, we have big concerns because according to the World Health Federation vision, the estimated CVD deaths is expected to exceed 22 million in 2030, and it's expected to rise to 32.3 million in 2050. And to prevent these shocking numbers, Vascular Wellness provides services 24/7, 365 days a year to improve patient outcomes, speed up therapy, lower infection rates, and reduce overall healthcare expenses. The key challenges that were faced by Vascular Wellness before our collaboration with Divine WebTech are the lack of ERP and iOS integration, the challenges in tracking patient and facility data, complex inventory management in Excel, reliance on multiple third-party software, absence of real-time reports for different departments, HIPAA-compliant chat and PHI management, HIPAA-compliant historical data migration, and user-friendly iOS app for clinicians. Now let's hear from Alan Atkin. He is the President and General Counsel of Vascular Wellness. He explains how Odoo has helped him find the right partner to implement ERP in his operations.
Hello, my name is Alan Etkin, President and General Counsel of Vascular Wellness. We looked on Odoo's partner list, filtered for healthcare experience, and found about 10 vendors across the world. After diligently assessing all the vendors based on their aptitude, expertise, delivery, timeline, references, flexibility, and multiple other factors, we came to a unanimous conclusion that it was Divine WebTech who perfectly suited our criteria across all spectrums and went ahead with them. Thanks to Odoo's effective filters that provide all required data with full transparency, we were able to find the partner we were looking for all along. During our vendor selection process, we engaged in initial discussions with several potential partners. Our objective was to identify a vendor who can not only meet our immediate needs, but also provide a strategic vision for our project while being highly adaptable and responsive in a tactical capacity. This was particularly crucial as we are transitioning from a previously unsuccessful vendor relationship and needed to regain lost ground in terms of project timelines. We carefully evaluated each vendor based on their ability to align with our expectations in terms of features, functionality, and overall project objectives. Divine WebTech stood out as a clear choice. They exhibited a unique combination of strategic thinking and tactical expertise that perfectly matched our requirements. Their proven track record and willingness to step in and take over from a previous vendor were instrumental in our decision-making process. Furthermore, Divine WebTech demonstrated a commitment to clear and open communication, ensuring that our expectations were consistently met. They were also price competitive, making their services affordable while not compromising on quality. Their agility and flexibility were additional factors that made them the ideal choice, both for the immediate project needs and our long-term goals as the project continues to evolve.
The key takeaways that Alan shared about Divine WebTech are Divine WebTech stood out as a clear and unique choice. Their services are affordable while not compromising on quality. Wow. Now moving on, Here are 5 major challenges that were faced by Vascular Wellness before the collaboration with Divine WebTech. The first one, they had no integration between traditional ERP and iOS apps that are easy to operate for clinicians. Second, dependent on multiple third-party software to manage data due to non-centralization. Third, difficulty in tracking critical patient and facility master data and reports in real time for separate business needs. Fourth, inability to manage inventory, which was recorded in complex Excel spreadsheets. And lastly, having a HIPAA-compliant chat integration and management of protected health information, or PHI as it's commonly known, and also the inability to migrate historical data to a new system without compromising strict HIPAA and PHI compliance. We are happy to share that Divine WebTech has solved and met all of these challenges, and how we actually do that, I'll mention that in just a little moment. First, I want to show you Joe Boland. He is a project manager at Vascular Wellness, and he's telling all about his experience. And then I'll share how we solved all of that.
Hi, I'm Joe Boland, Vissel Project Manager from Vascular Wellness. The previous ERP lacked many newer features and enhancements. This started to affect the overall productivity of the company. Due to the lack of functionality, many other third-party applications were required, and in some instances, daily operations and data gathering were handled by standalone spreadsheets. Since Odoo is an open source ERP platform, it's easy to customize, and we can integrate certain requirements as per our needs. The Odoo framework of modules seemed to fit the requirements we needed for our ERP system. In addition, Odoo appeared to be extensible for our specific healthcare use cases, as well as ensuring our ERP system will be HIPAA compliant. We wanted to ensure that the new ERP system being developed provided an intuitive and easy-to-use ERP application. The application must allow for our help desk to create service request tickets for vascular access procedures, and then assign those tickets to our in-field clinician staff. We also wanted to enable clinician staff to utilize a mobile application to document completed procedures and go paperless. Finally, for our accountants, we wanted to utilize the completed service online documentation to invoice the client. Working with Divine WebTech has been a highly positive experience. They've shown a strong commitment to understanding and implementing our Odoo requirements, using both standard modules and customized solutions effectively. Divine WebTech's back-end and front-end teams stand out for their skill and excellent communications, contributing greatly to our project's success. In summary, Divine WebTech has not just met, but exceeded our expectations in delivering tailored Odoo solutions, making the experience exceptionally positive and productive.
Well, his feedback about Divine WebTech: highly positive experience, commitment, customized solutions, stand out for skills and communication, exceed expectations. Now it's time to show you how all of this is done in practice. This is a pre-recorded demo that will show you the exact flow, the exact end-to-end flow from a service request to the generation of a clinical documentation. What you will see on the left, the video on the left is on Odoo itself. It's done by the admin on call at Vascular Wellness, and the video on the right is the iPad of the clinician. So you will see captions appearing for every status change, and you will see the service request starting on the left, and then it will generate notifications for the clinician on the right. Let's have a look. So the service request is created on the left on Odoo by the admin. We're first creating one without ETA. While all of this is done, the clinician is still not seeing anything, but it's going to appear in a moment. The admin is filling out everything. Aha, now the iPad, the clinician, is getting a notification. There we go. He opens a notification and he's seeing exactly what has been requested. You will see Bob and Henry. One is with ETA and the other one is without ETA. Status change again. See it appear. There's also an integrated Google Maps, so that the clinician knows exactly where to collect the supplies and also reach the ultimate destination. Clinician is selecting and getting all the supplies, adding the supplies to his bag. Boom, status change again on the left. He's on site. He can also add data, documents, PDFs, photos, any additional information the clinician can always add. Everything is always updated in real time. So now the clinician is adding pre-procedure data for both patients. The clinician can always, during the entire procedure, add data or adjust anything in real time, no problem. There we go. The admin is receiving the pre-procedure data needed. Still feeding the procedure data. Aha, on the left, status has ended. You can add supply if anything is needed. All the information is there. You can attach any document, any additional documents. There we go. Pictures, documents, PDFs. All of that can be added. You can revise if needed as well. Now the clinician is signing off, verifying the PDF, verifying everything. And then he can sign off. Case completed, PDF visible. All of this is on the back end on the left. Bob, done. Oh yeah, he can always add revision notes if needed. And it's constantly updated in real time. Revision notes appear. Clocking out. Beautiful. Our passionate team at Divine WebTag has delivered this successful implementation through customization with Odoo. And As a final testimonial, before I do that, I did promise you to show how we actually did all this. That is really important. So our approach to solve all of these challenges by vascular wellness were, we delivered a HIPAA-compliant data environment where data transfer is enabled without storing on a local service and device. Seamless data integration between Odoo ERP and iOS application made possible by Odoo API endpoints. Highly functional, easy to use iOS application for clinicians with several dashboards to manage caseload. Out-of-the-box inventory management solution without complex formula, with real-time tracking, as you saw, ability on a single interface only. Integrated clinical documentation. All applications under the Odoo umbrella, eliminating any third-party software dependence and ensuring a smooth functioning across all the verticals. For example, a purchase, a scheduling, appointments, clocking in, clocking out, the timesheets, the invoicing, and so much more. And the availability of real-time customized reports on demand for various business operations. As a last testimonial, I want to show you Brad Reedstrom. He is a CFO at Vascular Wellness, and he has something to say about the impact of the implementation on their daily workflow.
Hello, I'm Brad Reedstrom, the CFO for Vascular Wellness. We wanted to solve 3 main operational challenges of Vascular Wellness. First of all, we wanted to wrap our service workflow into a single system. Second, we wanted to electronically capture and store the point of service data all together in one place. And finally, third, we wanted to integrate billing and invoicing with our field service activity. There is not a process or sub-process within our service delivery flow that is not impacted by this system. It has been significant. Everything from receiving the initial service request, flowing through to invoicing based on what was actually provided to the patient, all the way through the collection of the invoice that was generated based on that activity. Divine Web Tech has been absolutely critical to addressing the operational challenges associated with our fragmented application map and the cumbersome processes which have simply not kept pace with the growth our company has been experiencing. Their deep knowledge of the Odoo system and its capabilities means that we have had a shorter development period, which translates for us into a quicker business impact. Working with Divine Web Tech has been a great experience. They're incredibly responsive. Whenever we've had questions, concerns, or needed assistance, Divine has been quick to address them, ensuring that our needs are promptly met. They have stuck to their committed schedules, which has been incredibly important. We rely on timely delivery to keep our operations running smoothly and to meet the business objectives that we're trying to achieve. Overall, our collaboration with Divine Web Tech has been marked by responsiveness and a commitment to timely execution. Both of these things have been invaluable to us as a partner.
Beautiful. His feedback about Divine Web Tech, incredible responsive to address questions and needs, and timely execution. Remember the shocking numbers I shared with you in the beginning of this presentation? Well, we stay positive because we believe in a better and brighter future. Through integrating humans and tech, we at Divine Web Tech, we believe in empowering your workforce through tech and leading your business to digitization. Connection is what brings you here. Connection, it was what keeps us going. And to connect is human, and digitization is the future of mankind. If you want to know more, then please scan this QR code, because you will find the case study and all the details and all the information that you need. And overall, I just want to end by saying, this is not just a success story of our client Vascular Wellness. This is also a success story of Divine Web Tech as an ERP service provider and Odoo as an ERP platform. Thank you.